in the House of Representatives last year, Representative Waters spearheaded the development of the Minority AIDS Initiative more than 10 years ago to address the alarming spread of HIV/AIDS among African Americans, Hispanics, and other minorities. Under her leadership, funding for the Minority AIDS Initiative has increased from the initial appropriation of $156 million in 1999 to approximately $400 million per year today. She is also the author of legislation to expand health services for patients with diabetes, cancer, and Alzheimer's disease. Representative Waters has also used her skill to shape public policy and deliver the goods. For example, $10 billion in Section 108 loan guarantees to cities for economic and infrastructure development, housing, and small business expansion. $50 million for Youth Fair Chance Program, which established an intensive job and life skills training program for unskilled and unemployed youth. Expansion of the U.S. debt relief for Africa and other developing nations, and the creation of a center for women's veterans. Now, as she confronts the issues of poverty, economic development, equal justice under law, healthcare reform, and HIV prevention, Congresswoman Waters enjoys a broad cross-section of support from diverse communities across the nation. Ladies and gentlemen, it is truly an honor to close this plenary session and to begin the journey this morning with Congresswoman and Representative Maxine Waters.
An honor to have been invited here at this important conference on prevention. I'm very pleased and excited about the attention that the President is giving to this issue, and I'm very pleased that the Washington Post had an excellent editorial in yesterday's paper about the conference. They said Tuesday's meeting in Atlanta will seek views from participants on how to reduce HIV infections, increase access to care, and reduce HIV-related health disparities. I'm delighted that the Washington Post gave it this attention and would like all of our major newspapers to continue to give attention to this epidemic. I wanted to be here not so much because I have much to add to prevention. As a matter of fact, I thought about what I would say for some time, and I began to reminisce about the many conferences that I've attended, the many town hall meetings I've been in, the many opportunities that have been afforded to me to talk about HIV and AIDS. And I know that all of you in this audience know a lot more about it than I do. You can routinely state the statistics, you know what's going on, you talk about funding in a very knowledgeable way, and on and on and on. So I thought, what else can I say? And then it dawned on me that while we have this initiative and the President's interest in creating these discussions, in the middle of all of this, we have these town hall meetings that are going on healthcare reform. You've been seeing them on television. You have been seeing town hall meetings that are initiated by members of Congress, and you've been seeing them disrupted with folks coming to shout down the leaders of these healthcare reform town hall meetings. You've seen the President in town hall meetings and folks attending even with guns on. It has been a very interesting debate, and it continues to rage. Healthcare reform, comprehensive, this nation. And it dawned on me, once I began to really focus, I cannot come here at a conference on prevention and not talk about healthcare reform. The two must be merged if we are to really get a discussion about HIV and AIDS prevention. We've got to talk about comprehensive health care for all Americans. And that's what I'm going to attempt to do this morning. These boards are not necessarily in the order that they should be in, but let's just start here. Health care coverage for all Americans. Health care coverage for everybody. Why is this so important? You cannot tell people you got to get tested. First of all, in addition to telling them to get tested, you got to make sure that testing is available. Right. And then after they get tested, then what? Where do they go for health care? What do they do? If we have comprehensive health care for all Americans, then it's not a question about where you go for your health care. So this is important. During the presidential debate, you heard some debate about perhaps we can't cover everybody, but perhaps we can cover a certain number of people. But ladies and gentlemen, we're now on the road where we have come to the consensus, at least those of us who think correctly about this, that there must be health care coverage for all Americans.
That's all big.
No more exclusions for pre-existing conditions.
We're depressed now.
Of providers and folks who are working to deal with this epidemic must know and understand that there are so many Americans that, first of all, don't even ask for health care insurance because they know they have a pre-existing condition and that you're going to be turned down in most cases. They will not cover you. So, health care for all Americans, no more exclusions. If you are tested, you find out you are HIV positive, go and get your health care because you will have a number of ways to do it. No more exclusions for pre-existing conditions. This should be high on your agenda to talk about. Guaranteed benefits. Now let's talk about it. There will be a health care exchange that should be up here someplace.